Hello, my name is Yvonne Taylor. I'm the Chief Operating Officer at Oxford Health NHS Foundation Trust. So how have we been trying to improve how we deliver services for patients over the last 2 years? Within some of our services, this has meant a whole remodelling of service. So adult mental health services have been remodelled with input from service users, carers and staff around how do we want to deliver services in the 21st century? And that has led to some fundamental changes around hours of operation and delivering integrated teams, joined up teams within the localities that patients can easily access 7 days a week and longer hours into the evening. For older people, that's meant looking at how do we bring mental and physical health care together around the needs of older people. All of us are living longer, and that means that we may face both physical and psychological problems going forward, and it's really important that we look at those together. For children's services, the focus has been around early intervention and getting out and working in schools. So the new school nursing contract which we have is all about having a member of staff in every secondary school and working into every primary school in the county of Oxfordshire. Another innovation which has been really important operationally is working with commissioning colleagues around something which is called outcome-based commissioning. The whole focus of outcome-based commissioning is about what are the outcomes that we're trying to achieve for the patient. And I think the really important feature of this is that part of those outcomes have to be set by patients and carers. So how we've been taking this forward in 2 ways. One, with joint work with around mental health, with 5 voluntary sector partners in Oxfordshire. The 6 organisations, including ourselves, provide quite a lot of the mental health pathways in Oxfordshire. And the difference this will make is that we're actually able to focus on the whole pathway. So our hope through that is, through this partnership approach, is that we will deliver a whole pathway around mental health services for adults in a much more joined up way than before. Another important area is around services for older people. I'm sure you've all heard a lot on the national press and on television about the need to join up services for older people, and that involves primary care, community, social care, as well as the acute hospitals. The final strand of delivering operational excellence is clearly financial. As we know, we are working in times of austerity and with increasing demand. And so it's even more important that we in the NHS are able to demonstrate that we can reduce bureaucracy for our staff and maximise the time that they can spend with patients.